Hi everyone, this week I'm bringing you an interesting case of dental fluorosis. Fluoride is a naturally occurring mineral that is absorbed by your body and is one of the building blocks of teeth and bones. Dental fluorosis is a condition in which the teeth absorb too much fluoride from the diet during development, and this makes the enamel of your teeth very brittle. This condition is more common in communities where the natural fluoride in the water is above standard safe levels or where the fluoride added to the water source is not properly controlled. Fluoride is added to most cities' water supply to help lower the risk of tooth decay in the population. But these levels need to be highly controlled since too little fluoride can put the community at a higher risk of tooth decay, and too much fluoride can bring about dental fluorosis. Now, there are certain regions of the world where the natural sources of water have really high concentrations of fluoride, and people who drink the water or use it to cook their food develop brittle teeth with enamel that has bright white patches, and in severe cases these patches become brown and the enamel of your teeth breaks apart easily. I recently saw a case of dental fluorosis in our Brea office, and I assumed that the patient had grown up in a community with high fluoride concentration in the water. However, the patient reported growing up in a suburb of Los Angeles where the water fluoridation has been properly managed for decades. So I asked him if he had any siblings with the same condition, and he said he has one sibling, but he was the only one with white spots on his teeth. I then asked him if maybe he liked to swallow or eat the toothpaste when brushing his teeth, which is what some kids like to do, and he answered yes. So my conclusion is that by swallowing the toothpaste, this patient consumed fluoride well in excess of what's needed for adequate tooth development, and that's what ultimately caused the weak enamel on his teeth. Dental fluorosis looks very similar to decalcification or loss of mineral from tooth decay. However, these are two very different conditions that in early stages should be treated differently. Like I mentioned before, tooth decalcification from decay is treated by adding fluoride supplements, while fluorosis requires topical application of minerals other than fluoride like calcium and phosphate. Since both decay and fluorosis can lead to tooth breakdown, ultimately these conditions should require restoration of the damaged portion of the tooth with fillings or crowns. Dental fluorosis can be prevented by making sure that the city where you live has a program to control the fluoride concentration in the water supply. You can usually find that information on the city's website, or you can call your local water department and they should be able to provide you with that information. Now, keep in mind that some reverse osmosis filtering systems can remove the fluoride from the water, and in case you find out that the fluoride available on the water supply is not enough, any dentist or a pediatrician can prescribe fluoride supplements to compensate for the missing fluoride in the diet. Fluoride can also be applied directly to the teeth as a gel or a varnish when you come to your clinics, and it is a safe and effective measure that we have used in our office to help reduce the risk of decay in our patients. Now, keep in mind that most kids below age 4 or 5 should be brushing their teeth with a non-fluoridated toothpaste, and they should only switch to fluoride toothpaste once they have learned to spit out and not swallow the toothpaste. For any questions or concerns regarding this subject, give us a call, post it on the comments, and remember to subscribe and click on the notification bell to stay up to date with these and other health matters. Thank you for watching, and see you in the next video.